speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Les porte-paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, Ministre de la Santé. Dr. Russell.
C'est une période difficile à traverser pour tous les gens du Nouveau-Brunswick. Alimentée par le variant Omicron hautement contagieux, la pandémie de COVID-19 se propage très rapidement, touchant les communautés et les familles dans tous les coins de notre province. Elle représente désormais une grave menace pour notre système de soins de santé. This is a difficult time for all New Brunswickers. Driven by the highly contagious Omicron variant, the COVID-19 pandemic is spreading very rapidly, impacting communities and families in every corner of our province. It now poses a grave threat to our healthcare system. I know that many of you are deeply troubled by these events, as am I. I know how frustrated and confusing it is to be confronted by frequent changes in policy and advice. I know how tired of this pandemic everyone is and how much we all would like to return to some kind of normalcy. The vast majority of New Brunswickers are doing their part to stem the tide of this latest wave of COVID-19. And I want to thank each and every one of you from the bottom of my heart. By following public health guidance and advice, limiting your contacts and getting vaccinated, you are helping to slow the spread of this fast-moving Omicron variant in this wave. There is a road back to somewhat of a normal life, and it runs through a vaccination clinic. And by this I mean that we need to continue to protect our healthcare system, and the more we can get people vaccinated and boosted, that is what's going to help the situation right now. Maintenant, plus jamais, il est urgent que chaque Néo-Brunswickois et Néo-Brunswickoise se fasse vacciner contre la COVID-19 et faire le rendez-vous pour la dose de rappel. Assurez-vous que vous avez reçu vos 2 doses et la dose de rappel si vous êtes éligible. Si vous avez de jeunes enfants, veillez à ce qu'ils soient vaccinés. Si vous êtes admissible à recevoir une dose de rappel, fixez un rendez-vous aujourd'hui. Now more than ever, it is urgent that every New Brunswicker become vaccinated against COVID-19 and get their booster if eligible. Please make sure that you have had your 2 doses of a vaccine. Parents, please ensure that your small children get vaccinated. If you are now eligible for a booster shot, make an appointment today. When you become eligible for a booster, get your shot as soon as you can. Vaccines are making a huge difference in the course of this pandemic. Booster shots increase protection against becoming hospitalized to near 90%. And perhaps this sounds odd to you, especially if you are one of the thousands of New Brunswickers who have contracted COVID-19 in the past few weeks despite being fully vaccinated. It is true that you can become infected with COVID-19 even when you have had 2 doses of the vaccine. But in most instances, New Brunswickers who have become infected after two doses of the vaccine and a booster dose are experiencing relatively mild symptoms and don't require hospitalization. Although we are now seeing hundreds of breakthrough cases each day, most of them don't require hospitalization. This is the direct result of receiving 2 doses of a COVID-19 vaccine and a booster. Severe illness and hospitalization due to COVID-19 continues to hit hardest at those who are unvaccinated. While they make up just a small slice of the overall population, the unvaccinated are requiring hospital care for COVID-19 well out of proportion to their numbers. Recently, we have been seeing younger unvaccinated individuals under the age of 50 and 40 succumbing to the virus. Depuis le 1er août, les Néo-Brunswickois non vaccinés ont été hospitalisés pour la COVID-19 à un taux de 283 31,5 pour 100 000, comparativement à 31,1 pour les personnes ayant reçu au moins 2 doses d'un vaccin contre la COVID-19. Since August 1st, unvaccinated New Brunswickers have been hospitalized for COVID-19 at a rate of 283.5 per 100,000, compared to 31.1 per 100,000 for those with at least 2 doses of a COVID-19 vaccine. In that same time period, unvaccinated New Brunswickers have required ICU care at the rate of 35.9 per 100,000 compared to 7.2 per 100,000 for the fully vaccinated population. Hier, le Nouveau-Brunswick comptait 63 patients COVID-19 hospitalisés, dont 19 aux soins intensifs. La situation actuelle est certes difficile, mais sans les vaccins, elle sera bien pire. Yesterday, there were 63 COVID-19 patients in hospital in New Brunswick, including 19 in ICU. As challenging as our current situation is, without vaccines, it would be much, much worse. There is increasing scientific evidence that the booster shot provides another level of defense against Omicron infection. And that's why it's so important that everyone receives their booster shot as soon as they are eligible. Right now, the following groups can obtain a booster shot if at least 5 months have passed since they received their second dose. All New Brunswickers aged 50 and older, residents of nursing homes and adult residential facilities, healthcare and long-term care workers, including home care workers and their immediate family members over the age of 18, school and daycare staff, members of First Nations communities. We have today added all pregnant women to the list of those immediately eligible. If you are in one of these groups, please book your booster shot today. There are plenty of appointments available right now through RHA clinics and participating pharmacies. Dans les jours à venir, à mesure que l'admissibilité sera élargie pour inclure les jeunes néo-brunswickois, la demande pour les vaccins augmentera. Si vous êtes actuellement admissible et que vous attendiez pour recevoir votre dose de rappel, c'est le moment de le faire. In the coming days, as eligibility is broadened to include younger New Brunswickers, demand for appointments will increase. If you are currently eligible and have been waiting to get your booster shot, now is the time. Minister Shephard will have more information about additional groups that will soon be eligible to receive a booster. It is also important to take the vaccine that is available right now. The Pfizer and Moderna vaccines are similar products, made in the same fashion with the same level of effectiveness. Please don't wait for a preferred brand because it won't be available to you for several months, and this is the information that we've received from the federal government. The federal government has told us that there will be a limited national supply of Pfizer until the spring. We have been advised to reserve our Pfizer supply for New Brunswickers under the age of 30 to reduce the incidence of adverse side effects in that age group. If you received Pfizer for your first 2 doses, you can safely have Moderna for your 3rd dose. Moderna boosters have been very well tolerated with relation to side effects. What matters right now is that everyone get a booster as soon as possible. There is no question that the situation we are in today is very serious. Ce qui importe en ce moment, c'est que tout le monde reçoive une dose de rappel le plus tôt que possible. Il ne fait aucun doute que la situation dans laquelle nous nous trouverons aujourd'hui est très grave. Thousands of New Brunswickers now have COVID-19. Their lives have been interrupted by this illness, as have family members and close contacts who are isolating to slow the spread of the virus. Workplaces, especially in our healthcare system, have been disrupted as workers fall ill or are required to isolate. But as hard as this all is, we are far better positioned to meet this challenge now than we would have been a year ago, thanks to vaccines. And based on our vaccination rates, New Brunswick does have a very high vaccination rate. 83% of us have received 2 doses, but only 40% have received their booster shot. This is not actually enough to protect not only the health system, but all workplaces. And so that is why I'm urging you to book your booster dose as soon as you are eligible. Au cours des 22 derniers mois, nous avons tous eu l'occasion d'apprendre et de mettre en pratique les principes de base de la lutte contre les infections. Portez un masque bien ajusté, évitez les endroits bondés, limitez vos contacts. We have all had the last 22 months to learn and practice the basic skills of infection control. Wear a well-fitting mask, avoid crowded places, keep your circle of contacts small, get tested when you have symptoms, and stay home when you have symptoms. These are skills that will get us through this most difficult phase of the COVID-19 pandemic. Please keep doing what you have been doing. Act with kindness and compassion for yourself and others. Show patience whenever you can, particularly to those who are working tirelessly to protect our health. Together, we will get through this. Merci. Thank you very much.
Good morning. Bonjour. Since the pandemic began nearly two years ago, our healthcare professionals have worked tirelessly to protect New Brunswickers. We are all forever grateful to these dedicated individuals who have provided quality, compassionate care under incredibly trying circumstances. During the last 22 months, our already fragile healthcare system has faced very serious challenges. With the spread of the highly contagious Omicron variant, we are feeling the strain more than ever. In the coming weeks, it is likely the healthcare system will be tested like never before. We expect that cases and hospitalizations will continue to rise. More healthcare workers will be off work because of COVID-19, and service reductions will be ongoing. Last week, the regional health authorities announced that hospitals will be providing emergency and urgent services only. Non-urgent and elective surgeries, procedures, and lab services will be postponed. The goal of these changes is to relocate healthcare staff to the areas of most need, including inpatient units, ICUs, emergency departments, COVID-19 assessment centers, and vaccination clinics. Horizon and Vitality Health Authorities and EMANB are working collaboratively to create a plan that will support the healthcare system during the coming weeks. Les gens du Nouveau-Brunswick ont aussi un rôle à jouer pour alléger le fardeau sur le système de santé. Je vous recommande fortement de continuer à suivre les consignes de santé publique. New Brunswickers also have a role to play in helping to reduce the burden on the system. I urge you to continue to follow public health guidance. This includes getting vaccinated and getting a booster dose when you are eligible. Vaccines are one of the greatest tools we have in protecting ourselves from serious illness, hospitalization, or death from COVID-19. That's why I'm pleased to announce that beginning Monday, January 10, everyone 18 and older will be eligible to receive a booster dose of an mRNA vaccine as long as 5 months has passed since their second dose. Eligible individuals will be able to book their appointment through a regional health authority clinic or through a pharmacy. This is an important step forward in protecting New Brunswickers from the impacts of Omicron. If you are 50 and older and have not yet booked your booster dose, now is the time to do so. Si vous avez 5 ans en plus et que vous n'avez pas encore fixé un rendez-vous pour votre dose de rappel, c'est maintenant qu'il faut les faire. We'll continue to make more appointments available in the coming weeks, but beginning Monday, many more New Brunswickers will be eligible for their booster. As Dr. Russell explained, Moderna will be provided to people 30 and older, and Pfizer-BioNTech will be administered to people under 30. Both vaccines are safe and efficient and provide additional protection against Omicron variant. This week, public health made a fundamental shift in its approach to testing, isolation, and contact tracing. This will help mitigate risk in our vulnerable populations and prevent hospitalizations, preserve human resources, protect critical infrastructure, and protect our healthcare system. Many people have questions about the new testing process, so I do want to take a moment to clarify. If you have COVID-19 symptoms, you must register online at gnb.ca/coronavirus for a PCR or a rapid point-of-care test. By completing the online form, you will be directed to take the type of test you are eligible to receive. People with symptoms and who are aged 2 to 49 and do not live in a vulnerable setting will be advised to take a rapid test. After registering your information, you will be able to book an appointment to pick up a rapid test at a distribution site. When you pick up your rapid test, you will be asked to present an email confirmation of your appointment. If you have a positive result from your rapid test, you are positive for COVID-19 and need to follow isolation guidance based on your vaccination status. PCR tests are reserved to protect our healthcare system and for those at highest risk of being hospitalized due to COVID-19. Groups that are eligible for a PCR test include healthcare workers and those who live or work in long-term care facilities, homeless shelters, and correctional facilities. People who are symptomatic and age 50 and over. People who are symptomatic and immunocompromised. People who are symptomatic and pregnant, and people who are identified as a priority by public health. People who need a PCR test for travel, First Nation people, and children under 2 are also eligible to receive a PCR test. The importance of the PCR for these higher risk groups is that we will have your information. The high-risk individuals 50+ who test positive for PCR in the community will get a health check call from public health and can connect individuals for additional supports if required. We want for you to receive the primary health care you need as soon as possible to avoid the potential for hospitalizations. I also want to be clear that if you are isolating because of your symptoms, you are allowed to leave isolation for a test appointment or to receive medical attention if required. I know there has been some confusion over the past days as this new process has come into effect. I have heard instances of symptomatic people under 50 visiting emergency departments to receive a PCR test. Please do not do this. Visiting an emergency room when you have symptoms puts others at risk. Instead, follow the steps and book an appointment to get the test you are eligible to receive. This is a significant change, and it will be an adjustment for all of us. The benefit of this appointment-only model is that it will ensure symptomatic New Brunswickers who are not eligible to receive a PCR test can register to pick up a rapid test in a timely manner. In the past couple of weeks, we saw that some distribution sites for rapid tests depleted their stocks ahead of schedule. It was also difficult to anticipate demand at each site. Now, everyone will be able to access the tests they need, confirm whether they are positive for COVID-19, and take the appropriate steps to protect others. We have entered a new stage in the pandemic. We recognize that we cannot keep cases of Omicron virus contained, but we can all take actions to mitigate the impacts. We all know the things we need to do to protect ourselves and others. We need to limit our contacts, wear a well-fitted mask, and physically distance from others. We need to get vaccinated, and also important to get a booster when we are eligible. If we test positive for COVID-19, we need to isolate and inform our close contacts. These are the steps we can take to protect ourselves and our families. We know what to do to protect our healthcare system. By continuing to get vaccinated and booster doses, and by following simple guidance, we will move beyond this current challenging phase of the pandemic together. Thank you. Merci.
Merci, Minister Shephard. Dr. Russell, thank you, Minister Shephard and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle. Chaque journaliste aura une question. We'll now proceed with questions from the members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Timothy Jakes, Campbellton Tribune.
Yes, my question, I guess, would be for the minister. In communities like Campbellton, there's only one place to pick up the rapid test. And in Campbellton's case, it's at the back of the city at the hospital in a place that isn't convenient or easy to reach without a car, and there's no public transportation here. Why not have better delivery options for the rapid test for those without personal transportation? Particularly since, they'd be symptomatic. You're not sure you want to take a taxi or a bus. And do you not fear that this kind of barrier to accessibility will affect necessary testing in the communities where this is the case?
This is a really important question, and I want to thank you for asking it. There are bugs to work out. This is relatively new. Especially in the context of how we're changing the testing policy. And the department is working with the RHAs to try to alleviate some of these barriers. It's really important to note that in utilizing other areas to distribute the tests, we will be exposing people to those who might be symptomatic. And so that's the challenge that they're trying to resolve at this time. But we are working diligently to try to figure that part out. And as soon as we can make changes that make it easier for people to get their rapid tests, we certainly will.
Thank you. John Chillibeck, Brunswick News.
Hi, I'm hoping both Jennifer Russell and Dorothy Shephard could address this question. We've heard over and over that the ICU and the hospitalization of COVID patients has been the majority people who are unvaccinated. And we've heard today, again, about the urgency of vaccinations and boosters. And while New Brunswick has a really high rate of vaccination, there's still 2 out of 10 people walking around there who aren't fully vaccinated, who are eligible. In Europe, they've taken, in parts of Europe, such as Austria, Greece, and Germany, they're taking a much more severe tact. They're basically putting in vaccine mandates, making it very difficult for people to live if they are unvaccinated. As of February in Austria, people will be fined if they're not vaccinated. So I'm just wondering why New Brunswick hasn't taken a more severe approach if, in fact, we're worried that our health system will be swamped. We've already seen the knock-on effects with people through no fault of their own can't get the services they need because unvaccinated people are swamping our hospitals. So why aren't we taking a more severe approach?
I don't know of any place in Canada that is taking a more severe approach. And so, that as hard as this is, we're 22 months in to a pretty lengthy battle. And I think that we are going to have to continue on this path and try to stay ahead of it as much as we can as we work through this, this pandemic. And at some point, we will be able to move forward, I believe, in living with COVID as we have done with many other illnesses. So at this time, it's not a point of discussion. We are working diligently to prepare and plan We know that employers are going to be affected every single day throughout the next 4 to 6 weeks. We know that critical infrastructure employees will be affected by COVID. It is a serious issue, but we maintain right now that education, pushing for those to get vaccinated, showing the differences that the vaccine makes, as Dr. Russell did today, that will be the path we'll stay on for the near future. I can't say what happens down the road, but there isn't any place in Canada that is looking at mandates.
Nathan DeLong, Miramichi Leader.
Good morning. Can you hear me okay?
Perfectly, thank you.
Thanks, Bruce. My question is for Minister Shephard or Dr. Russell, whichever of you can answer. I've been hearing concerns from a family physician in Miramichi saying that the province should consider locking down and or tightening public health restrictions to get the spread of the Omicron variant under control. I'm wondering just what's your response to this? Has this been considered? Why or why not?
Well, we have a level 3, so obviously it has been considered, and there's nothing stating that we won't go to level 3 as we continue through our circumstances. What's important to know is that every single time we make a decision, there has been a great deal of work put forward by public health and the assessment team, and they look at many, many factors, as I've explained before. So we will not hesitate to go to level 3 if we feel that that's the necessary action to take and public health supports it. So it's not off the table. It will never be based on one opinion. It will always be based on the diligent work of the public health assessment team and the input from many, many directions.
Travis Fortnum, Global TV.
Hi there. My question is also for Minister Shephard, and it's a little further to the previous question. Specifically, we've heard you say that in the coming weeks we'll see the healthcare system tested like never before. So why isn't that enough justification to move to stricter measures to soften that coming blow?
There's always been a question of how we mitigate and proceed with COVID right back to March of 2020. And so the assessment is very, very important. And it is provided by a team of experts who look at our epidemiology, who look at our social circumstances, who look at our healthcare system. All of those things come into play. And the best decision we can make is the best decision we make on all the information on any given day. And that's what we do. And so I do not say that we won't go to a level 3 if it's necessary, but it will be done at the appropriate time.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is likely for Minister Shephard. Approximately how many people thus far have reported their positive status on a rapid test using the GNB website? Is there also a number people can call if they don't have a computer or access to internet? And does it seem to be working, or is it likely that there are many unreported cases?
So good question. And in the past 6 days, we have 2,009 POCT positive test results that were reported. And we know that we're not going to get every single positive case registered. And so I think it's really important to know that right now, online is the way that it can be reported. And until, if we resolve it with a phone number in the future, that could happen. But really, the indication that we're looking for is to have a general expectation that we can understand with the greatest certainty that we can attain with public participation, that we'll have a fairly good indication of what our numbers are at. And of course, we'll have our PCR tests, which will be affirmative.
Thank you. Pascal Rochnog, Radio-Canada.
Oui, bonjour. Ma question est pour la Dr. Russell. Est-ce que vous pouvez nous expliquer en français un peu pourquoi vous abaissez l'âge d'admissibilité pour la dose de rappel plus rapidement que prévu? Parce qu'initialement, c'était seulement prévu pour le mois de février. Donc, qu'est-ce qui explique cette décision-là?
Alors, on voulait vraiment nous assurer que les gens qui étaient éligibles à ce moment-ci, les 50 plus et les gens qui ont plus de risques à ce moment-ci, on a la capacité, on a les doses, alors c'est vraiment le temps d'essayer de combattre le variant Omicron avec les doses de rappel à ce moment-ci.
Merci. Laura. Laura Brown, sorry, CTV. Jacques
Bruce,
Poit-
she's just having some technical difficulties at the moment. If you could come back to her.
Perfect. I'm going to go to Jacques Poitras then. Thank you.
Hi, my question's for Minister Shephard. We had these problems or this confusion with the rapid test sign-up site. On Wednesday night, the wrong level 2 information was posted in French for a while, confusing a lot of people. And I've spoken to several people who say these errors or missteps, while they may be small on their own, are adding up to creating a lack of confidence in how things are being handled right now. Can you address that, please?
Sure. I think the anxiety is overall in the situation, and while I absolutely acknowledge that there are some little errors that cause frustration, I have to say that the Department of Health, the regional health authorities, Ambulance New Brunswick, Extramural, have all been working around the clock since everyone broke for Christmas. I have photos of 3Z on the 3rd floor of the department where the Emergency Operations Center is, and there's not an empty desk. They have been working around the clock. Service New Brunswick, of course, was off for a good bit of Christmas, but they came back early, helped us to implement many of the structures that we have in very, very short time. And so I ask for New Brunswickers' patience in understanding that there will be little glitches. I expect on Monday, when we open up to 18 plus, there will be more glitches because of the volume of people who will register for vaccine clinics. I spoke on a federal, provincial, territorial meeting yesterday afternoon. I can tell you that every single province is changing how they're using their point-of-care tests, how they're implementing new testing policies. They are all struggling to get the proper communication to everyone quickly and as accurately as they can. This is a very big lift when we have to pivot so quickly. Omicron has forced that, and I ask for New Brunswickers' patience in understanding that perfection could not be the holdback for the good.
Thank you. Cédric Thévin, Acadie Nouvelle.
Bonjour, c'est une question pour la ministre Shephard. J'aimerais savoir si la province comptait, par exemple, imiter le Québec qui va demander des preuves vaccinales pour que les gens puissent entrer dans les magasins d'alcool et de cannabis. Elle a dit tout à l'heure qu'elle ne comptait pas pour l'instant obliger la vaccination, comme ça peut se faire dans des pays en Europe, mais est-ce que ce genre d'options comme celle du Québec peuvent être envisageables?
It's not part of our level 3 winter plan, so I at this time, I don't see that.
Thank you. Adam Harris, Brunswick News.
Thanks, Bruce. Happy New Year's, guys. Question for Minister Shephard on rapid tests. The federal government's moved to a per capita distribution of rapid tests. And I just wanted your reaction to that. New Brunswick's used relatively fewer rapid tests early on in the pandemic compared to other provinces. Now you can't get your fair share. Does this disadvantage New Brunswick? Your thoughts on that move?
Well, you're correct. The federal government will be moving to a per capita basis, and of the 140 million that they have currently, putting together for deliveries to the provinces, we're going to see 2.9 million of those coming to the province of New Brunswick. That is why every single province is looking at how they utilize POCT tests, and we feel that we're finding a very good balance in helping the people of our province get rapid access to testing. So if you're 50 and over, you can book a PCR test if you're symptomatic. And if you're symptomatic and you're 2 years old to 49, you can book an appointment to pick up rapid point of care tests. And that way we won't have the long waits for PCR testing. And we'll be able to focus on the most vulnerable in our communities. I believe that we're in the same boat as every other province. This is going to a per capita basis, and we need to be prudent about how we focus our use of them.
Thank you. Laura Brown, CTV.
Hi there. I'm wondering about essential services. There's some really concerned ones, specifically nursing homes and also like fire and police, that are concerned that they've been told to use rapid tests for so long, and now they won't have a proper supply of them to ensure that there's no gaps in those services. I'm wondering, is there any that are going to be set aside over the next month for those services?
It's my understanding that the Department of Health is working with the Nursing Home Association and long-term care facilities, adult residential facilities, through the Department of Social Development, and they're going to be managing supply for those for those long-term care facilities. I think it's important to note that still the change in policy is that we start looking towards symptomatic assessments. So if an employee shows up for work and they have a symptom, then they can test and try to be as sure as they can before working in a vulnerable sector.
Thank you. Alexandre Boudreau, l'Acadie Nouvelle.
Oui, bonjour, est-ce que vous m'entendez bien?
Plus fort, oui.
Plus fort?
Oui.
Vous me direz si ça marche. Ma question est peut-être pour la Dr. Russell, peut-être que la ministre peut répondre aussi. J'aimerais savoir si vous savez quand on verra la fin de la vague d'Omicron et selon vos prévisions, dans le fond, qu'est-ce qui vous permet de dire que vos prévisions sont bonnes, sont précises si on teste beaucoup moins et qu'on n'a probablement pas une bonne idée de combien de cas il y a réellement?
Alors, pour le dépistage, c'est vraiment, c'est plus le nombre de cas qu'on utilise pour décider comment sévère la situation est actuellement. C'est vraiment le niveau de cas dans les hôpitaux et des soins intensifs, et aussi le nombre de travailleurs de santé qui sont impliqués dans le COVID-19 ou ils sont en isolement. Alors, le système de santé, à ce moment-ci, travaille très prochement avec le département de santé pour faire certaine qu'il peut gérer la situation comme telle. Et au sujet des PCR, ça, c'est vraiment réservé pour les gens qui sont plus à risque pour être admis à les hôpitaux. Alors, ça aussi, le fait qu'on a les ressources, toutes alignées pour appuyer les gens qui sont plus à risque, plus vulnérables. Les réseaux sont vraiment dirigés dans cette direction parce que c'est ça que le vague de Omicron nécessite à ce moment-ci.
Merci. Bobby Jean McKinnon with CBC.
Yes, hello, can you hear me?
Yes, thank you.
Yes, thank you. You've said the province will be getting, I think it's 4.7 million rapid tests from the federal government next week. Just to clarify, that's tests, not kits. And will that renewed supply change the requirement for an appointment system or the province's guidance on testing in any way?
Well, that's actually why we made the change, Bobby Jean. And the amount that we're getting is 2.9 million tests, not kits. So 2.9 million tests are being received from the federal government from their current supply of 140 million. That's New Brunswick's per capita allotment. And that's why we've made the change in our testing policy so that we can be prudent about the distribution of our rapid tests and we can ensure that we have availability of PCR testing assessments for those who are 50 plus.
Thank you. Erica Butler, CHMA.
Hi there. To continue on the rapid test line of questions here, my questions regarding distribution outside of the cities. Areas like Sackville have been relying on weekly mobile sites, but now that you're requiring people to wait until they have symptoms, weekly pickup no longer really works. So I'm just wondering, is there a plan to have test kits available throughout the week in rural areas of the province so that people can pick them up when they have symptoms?
I appreciate that, and that's actually one of the logistics that we are still trying to work out. We realize that we need to make them available more than once a week. So hopefully in the very next couple of business days, we're going to have that resolved.
Thank you. Ailish Bonang, CTV.
Hi, folks. My question is likely for Minister Shephard, but Dr. Russell, if you would like to jump in as well, by all means. Is there any sort of plan in the works coming together to try and make up for all of the postponed or canceled hospital procedures across the province?
Well, absolutely, but it depends on how this, how our Omicron crisis fans out. We're expecting that over the next 4 to 6 weeks, we will be in a pretty serious crunch with our healthcare services. And I just want to say that, we're going to lose healthcare workers to Omicron, whether it be to isolating or whether it's, positive tests. Some people may not be over it in 5 days. And so, but it's also going to affect other critical infrastructures. We have major employers in this province who have hundreds of employees out because of Omicron. And so this is going to be an all-out provincial strategy to try to weather this storm in the best way possible. So what I can say is that we have ramped up surgeries before and procedures, when we've, I guess I'll give the hip and knee surgeries, as an example, that we were able to ramp them up to pre-COVID days last year. And so there are going to have to be strategies that we work together with our RHAs and EMA&B and the department. We'll all pull together to do everything we can to minimize the impacts of the diversions we have to make under these circumstances.
Thank you. Marlo Glass, Brunswick News.
Thanks, Bruce. Why wasn't PCR testing capacity ramped up sooner to address the incoming surge of Omicron? And will there be changes to the online testing booking system based on public feedback?
Could you repeat the first part of your question, Marlo?
I was wondering why testing capacity wasn't ramped up sooner, perhaps before the holidays, to address the incoming surge of Omicron.
Was it PCR you said or POCT?
I guess both.
Okay, all right. So thank you for the question. It actually was, but you've got to look at the dynamics of everything that we're providing in the province. Vaccination is extremely important. And then we began children 5 to 11. We're putting out booster shots. We can do approximately 42,000 vaccinations per week. We are going to ramp that up to 55 to 60,000 per week in the coming days. When it comes to POCT and PCR, you saw before Christmas that, and shortly thereafter, where we had long lists of people waiting for PCR tests. That's what part of the reason why we had to change the policy for testing. And with public health guidance, we're able to see that 50 plus are at a higher risk of severe consequences to contracting COVID-19. And those who are younger, the symptoms could be managed a little easier. And so POCT becomes a tool that helps individuals in community that they're going to have able to get access to in order to, for lack of a better word, self-diagnose with a POCT test. And those who we know we need to follow more closely will have a PCR test. I had an example yesterday of someone who booked, who was over 50. They went online, they went through the process, they saw that they had to book a PCR test. They did that about 6:30, they got a call by 7, and they have an appointment this morning for their tests. That's what should happen. Instead of last week, you would have had to have a POCT test. If you were positive, then you called to get a PCR test. Some people were waiting 4 to 6 days if they weren't in a high priority group. But now they'll get their POCT test and they'll know that if it's positive, they're isolating for 5 days. So these improvements really are that. They're improvements. It's just a big shift all at once.
Thank you, Dr. Russell.
Will there be
I
changes?
was just going to,
Sorry.
my apologies. I was just going to add to what Minister Shephard was saying. Basically, the Omicron wave has really caused the entire country to shift their priorities right now from a COVID zero to a mitigation strategy. And that mitigation requires us to prioritize all of our human resources at this time, whether it's time, whether it's expertise, whether it's location, whether it's skill sets. So that is also part of what is factored into our new approach with respect to testing. And again, we're in the same situation as other provinces and jurisdictions in the country who are also making this shift.
Thank you. Hadil Ibrahim, CBC.
Thank you. This is for both Dr. Russell and the Minister. Are triggers for moving from one level to another changing now that you're no longer providing holistic daily case counts or detecting all cases with PCR tests? As of right now, moving from level 2 to level 3 requires an increase in average cases.
Okay, yeah.
So I'll just start and then I'll let Minister Shephard finish. So the triggers are triggers for having our assessments. We are having regular assessments with our teams, with epidemiologists and medical officers, et cetera. And really and truly, our approach right now really is around hospitalizations and in terms of the testing, et cetera, and all of the resources that we have right now are really directed to the higher risk areas with respect to hospitalizations and doing as much as we can to keep people out of hospital. So the triggers haven't changed. The parameters haven't changed in terms of having those assessments. We continue to have those regular assessments.
Minister?
And really, Dr. Russell has summed it up. I think it's important to note that Omicron has been around since November, and if I'm not mistaken, the end of November. So that's how rapidly the situation changed from what we dealt with in 2020 to Delta in the latter part of 21 to Omicron really coming in a very, very fast and furious wave. And so all of these policies are really being done with the best information we have on a daily basis. And we know it's hard, but that's what we have to do right now. We have to be agile.
Thank you. Kevin Bissett, Canadian Press.
Good morning. Question for Minister Shephard. Can you give an update on the number of healthcare staff that are isolating at home because of COVID-19? And do you have an indication of how COVID is impacting the staffing levels at long-term care homes?
I don't have the information on long-term care homes, but I can imagine that they will be under the same stress as our healthcare system. As of today, we have 347 positive healthcare workers out with COVID-19, and 198 employees are isolating.
Thank you. Nicolas Steinbach, Radio-Canada.
Bonjour, merci Bruce. Question pour la ministre de la Santé. Concernant le syndrome neurologique de cause inconnue, le docteur Alière Mahero demande maintenant, et les familles, et le groupe Bloodwatch aussi, le groupe de patients, demandent une commission fédérale d'enquête pour faire la lumière sur la maladie, mais aussi pour faire des tests dans l'environnement, faire des analyses des patients et des tissus également des victimes. Est-ce que la province du Nouveau-Brunswick et la ministre de la Santé est ouverte à la tenue de ce genre d'enquête fédérale?
I've always maintained that as we proceed through this investigation, that the preliminary work that should have been done at the beginning, which was the environmental assessments of the files and the expert review by the committee of the 48 cases that are initially referred to the mine clinic. I've always maintained that once this process is done, if we have to go further, we won't hesitate to do that. But this is the preliminary work that should have been done in the first place, and we are 1 year out, and that should be arriving soon. With the neurological assessments, and then from there we'll proceed as we have to. But we won't predetermine any of that until this work is completed.
Thank you. Merci beaucoup. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.